Hey everybody, John Forelli from Sage West Healthcare. I'm standing here outside the emergency room in our Lander campus with an update on the COVID-19, or as more commonly known, the coronavirus. We want to let you know everything that's going on in the hospital, everything that's going on in the county, the collaboration that we have with the state and the federal government. I'm joined by two guests today, Dr. Mel Meyer, who is an emergency room physician here in Sage West, and Dr. Brian Gee, who is the Fremont County Health Director. Mel, tell us a little bit about what's going on in the hospital.
In the hospital, we've done a lot of work to prepare for this. We've got overflow capabilities in the hospital for influx of patients that happen to come in and need to be hospitalized. We've got full PPE gear, personal protective equipment for all of the staff, for those that happen to work with the COVID positive patients. I am wearing a mask, which will help me decrease the chance of me spreading the disease if something would happen. Our staff as well are wearing masks in the hospital to help decrease the spread of the virus. When patients come into the emergency department or into the hospital, and staff, we're all being screened for our temperature and our symptoms. We are limiting the number of visitors, so no visitors can come in with a patient unless it's a pediatric patient, OB patient, or end-of-life patient. I feel very comfortable with what we have done, and we're in conjunction with Riverton. We're both working very hard together to make sure that we have the preparedness that we need.
So Mel, you feel good that we've created a safe environment for our patients and visitors, and at the same time created an environment that will accept people who fear that they may be infected.
Absolutely.
Great, that's great. Brian, tell us what the county's doing and how you're collaborating with other regional and federal authorities.
Thank you, John. As many of you know, we've created an incident command system to help us meet everybody's needs, including the hospital and any other entities in the county. So hopefully if we do get a surge of patients, that will be helpful. We'd also like to say that we're going to put out two numbers that people can call if they've been seen by a physician and told they might have the COVID virus and said to go home and self-isolate. Some of the things that you can think about, we're actually practicing a little social distancing right now with about 6 feet between us. Dr. Meyer, if you would have had a cough and a fever, he's also helping us out by wearing a mask. We can also do other things. We can wash our hands often. We can think about using hand sanitizer when we don't have soap. We want to clean all those high-touch surfaces as best we can. And to know that Fremont County Public Health, in conjunction with the Incident Command and the other providers in our county, are working very hard to try to keep you all healthy and safe.
Well, one thing I think everybody should know is that there is a tremendous amount of collaboration between all of the related parties. I've never seen a group of people come together and work more collaboratively. And so you, as the general population, the people who are out there, fearful of what may be happening, should rest comfortably that your safety is well in hand. Thanks.